Hey guys, it's Steven here at CORE Therapy and Pilates. Again, today I wanted to go over some what we started talking about yesterday with the MRI. Some people reached out to me and were curious about why I didn't think MRIs were as important, or I seem to say that they weren't that important with what I said yesterday. And I want to go over some of the statistics and why I believe that. The current statistics from today say that if you take people without back pain and go do an MRI or a CT scan, that you'll get degenerative disc changes, which I'll explain in a second. In the 20-year-olds, 37% of all 20-year-olds will have degenerative disc changes. 50-year-olds will have 80%, all 50-year-olds, 80% of them will have disc degenerative changes, 80-year-olds will have 96% of them will have changes. So that's a pretty big change. And what does that mean on disc degeneration? It means the space between the two vertebrae here. We've got a lumbar vertebra here, a lumbar vertebra here. The space between it where the disc is has gotten very compressed, where there should have a little bit of a sponginess in the space. It's now gotten very shortened and compressed, and that's what we call disc degeneration. So it's pretty common. The older you get, the more common it is. So if I get a 50-year-old woman in here with a bulging disc, with a degenerative disc change on her MRI, I'm not that concerned about that image, because again, it's so common in that scenario. So now I want to talk about disc bulging. So disc bulging, instead of it being the compressing of the disc bulging is where we look at the same model and we see this tiny little red piece right here. So here's the disc, the disc between, and this little red piece right here starts to pop out. And what it does is it hits this little nerve, and as this little nerve pops out and goes down into your leg, or if it's in your neck, it goes down into your arm. That's where you'll get some discomfort. So let's talk about the statistics of MRIs for people who do not have back pain, but show up with a bulging disc on their MRI. 20-year-olds, 30% will have a bulging disc without pain or symptoms. 50-year-olds, 60% will have it, and 80-year-olds, 84% will have it. So it's a very common finding for people who don't have back pain. So for us to say that someone has back pain and their MRI shows that it's a bulging disc at L4 or 5, it doesn't necessarily mean that that's the true cause of the problem. So we can figure that out clinically and find out what the problem is, and we can do things before you get an MRI and actually make you give you relief and make you feel better before you spend all that money on the MRI. If things don't get better with physical therapy, then we can always send you in for an MRI. But again, with these statistics that I just went over, it's kind of a scary thing. So that's it for today. I hope y'all have a great day. It's beautiful outside in Austin. People are showing up. Austin City Limits starts today, so it's a gorgeous day for the festival. To all of y'all going out today, enjoy, stay safe, do your release work before you go. Anybody have any comments, put them below, and that's it. Have a great day.